Half a day, everybody, for Health Check this week. I am at IHP right across the street from our Harmon studios, and I have here Dr. Leia. She is a pediatrician. She's been on Guam since February, and she has made it her life's work to make you as very healthy and happy as you can be as we head back to school. So, Dr. Leia, thanks for joining me. Half a day.
Thank you for having me. Half a day to you, too.
Okay, and you can't see this right now, but her shoes are really awesome. She's got running shoes, which absolutely match her scrubs, and they're incredible.
Okay. I try.
Yeah. Okay. And as a pediatrician, it is your job to provide not only health advice and proper health care to young ones and everything like that, but to put them at ease. And definitely when we go back to school and everything like that, it's a very stressful time. There's a lot of positive anxiety, a lot of like nervousness. So what are you seeing as far as what kids are asking when they go back to school?
Yeah. So back to school exams are very important to ensure that kids are ready and prepared mentally and physically for the upcoming school year.
Now, doctor's exams, not the exams you have at the end of the quarter. You'll get to that like pretty soon enough, yeah.
Yes,
but those exams are equally important.
Yes, exactly.
Yeah.
Yes, they are.
Yeah. So what are you looking at as far as giving kids like a proper workup when they head back to school? And as a pediatrician, you actually deal with patients all the way through college age.
Yes, typically do. Yes. So. In addition to scheduling their physical exam, we also make sure that they're up to date with their vaccinations. So it's recommended when they come in for their back to school exam to bring their records with them so we can ensure that they're up to date and give them any necessary vaccines if needed, because these are required for school entry.
And of course, when you go back to school, you're dealing with possibly being among thousands of your peers, in addition to like adults and everything like that.
Yes.
Infectious disease is just going to like go around, the typical colds, flus, and everything like that.
Right.
So, what types of vaccinations should parents be aware of?
Yes. So, particularly in the upcoming flu season, we're thinking about getting flu vaccine. Flu season typically starts about a month or so after school begins here. We anticipate having the vaccines available sometime between the middle to end of September. And it's always recommended to have your child vaccinated for the flu annually.
And as a new Guamanian, you're probably really enjoying our rainy season right now as a physician, right?
Exactly. Yes.
Are you seeing an uptake in the number of like young ones who come in for common colds?
Yeah, they will. We're starting to get into that season now, but anticipate having more of those in the next few months as school begins, when kids are a lot in closer quarters, being back in classrooms again, and participating in other athletics.
Right on. Okay, so elementary school, middle school, high school. What should parents know about when is the optimal time to make an appointment? Because you've got school supplies, uniforms, like the whole thing to worry about.
Right. So as best as you can, it's always encouraged to come early and to ensure that your child is safe and healthy and able to participate not only in extracurriculars but also in sports too. So preparing them to as early as possible to ensure there's no delays for them getting enrolled in school and also to participate in other activities.
Very well. Okay, so what if a young patient, Dr. Lee, is missing some of the vaccines? Because that's just it happens, right?
Yes, absolutely.
Yeah. So can they catch up?
Yes, they can. Yes, and we're able at IHP we're able to provide vaccinations during their visit when they schedule.
Okay, and how long are those good for? And do they have to disclose to their school nurse or to the administration? It's like, hey, I just got da 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 da, or is that kind of like a HIPAA thing?
Well, we for most schools they do require vaccines, so it is important to have these vaccines and documented, and this information will be provided to the school.
Very
for
nice.
Those cases.
Okay. Flu shots. We always got to talk about that. It's a seasonal thing. The flu continues to evolve. Of course, everybody's familiar with COVID, and as we now go back to school, there are still kids that dealt with like the COVID years. So when it comes to flu shots, are they absolutely required before school starts?
It's recommended. They're not a requirement per se for school, but it is recommended for all. For everyone, really, to have their annual flu vaccine to make sure they're protected from the flu.
And is the flu vaccine, is that the same one that like adults would get and the elderly would get and like newborns would get? Is it across the board, the flu vaccine is the flu vaccine?
Yes, it is.
Okay, very nice. Okay, now let's talk about the ones that are going to college. What do our undergrads have to worry about? Well, a whole lot, but as far as getting ready for college.
Yes, so they also are recommended to have a physical exam before coming into college, in addition to bringing their vaccine records as well to make sure they're up to date. Some colleges require other specific documentation, so we usually just recommend that they either call the school directly or look on their website to make sure they don't have any additional documentation that's necessary before starting college. And anything that they do come across, it's important that they bring that to their visit to as early as possible before going to school, so there's no delays.
Yeah, I'm just realizing, Doc, with all of the public schools, private schools, you've got the Dodea School and UOG and the Guam Community College and everything, you got a lot on your plate.
Yes, it is. It's very busy, but it's also a lot of fun to get everyone ready for the school year.
Oh, there you go. Okay, now what do parents know? Because we can't keep everybody from getting sick. I mean, you want to take your vitamins, you want to exercise, get your rest, keep your stress down and everything so you can be as healthy as possible. This is the expert right now. Why are you listening to me on this stuff? But what can parents do to keep their kids from getting sick? What can they do to control what they can control?
Yeah. So in general, hand hygiene is really important. So I always encourage parents to tell their kids to frequently wash their hands, cover their mouths when they're coughing or sneezing, and to not share personal items or drinks to prevent a spread of illness. Also, typically during the peak flu and cold season, wearing a mask may also be helpful to prevent spread of viruses and other illnesses.
Masks still work. That thing has not gone away, everybody, and it's absolutely preventable. Yeah, very, very effective and everything. Okay, what should a child stay home at school for? Like if they can say, oh, I've got a little bit of a cough, but not a fever. I've got like a little bit of a tummy ache, but I'm not, I'm not nauseous. Yeah.
Right. It's important that they stay home if they have a fever, which is 100.4 degrees Fahrenheit and higher is considered a fever. So all kids, regardless of what other illnesses they have, should stay home until they have no fever for 24 hours without any fever-reducing medications.
Okay, so the fever is the big one.
It is, yes. Yeah. And the presence of a fever does also indicate that your body's still fighting an infection, so it's important for that to not be present when they return to school or daycare. But otherwise, coughs, runny noses, those are typically okay to go to daycare or school, provided they still don't have a fever.
Oh, daycare, very interesting. I didn't even think about that too. Yeah, you do have a lot on your plate.
Yeah.
Okay.
Daycare included.
When is it time to see professionals like you? Like if a kid's, said, okay, well, I may have a low-grade fever, or I've got a combination of, aches and pains, slight headache, runny nose, and everything like that. At what point do I know I got to bring my kid in to see Dr. Leia?
Sure. In general, a prolonged fever, so a fever that lasts greater than 5 days, any trouble breathing, so like wheezing, like rapid breathing, or if your child's not staying hydrated okay, so symptoms of dehydration like dry lips or pale skin or reduced urine output, I always recommend touching base with a doctor to have an appointment. Certainly, if there's any acute concerns or you're concerned about the severity of the symptoms, I always recommend going to an urgent care clinic or to the ER.
What can kids do to make sure that they get the best possible care when they come to see the doctor, about being honest about like how they're feeling, what their symptoms are, like how long they've been feeling this? Moana up here on the wall is a great way to make kids at ease.
Yes, yeah. And always on the front, I explain to parents and their kids that we're here to help them and to be honest, just to have a good understanding of what they're here for and ways that we can help them from the front end. But we also have other things to do to put them at ease if they do have to have any sort of procedures done or other maybe challenging aspects such as getting a vaccination during their care. We have ways to give them like stickers, we can give them ice pops, other things afterwards that they can look forward to realize that being in the doctor's office is not as scary as they think it will be, but that it's actually a neat time to bring the family together to make sure that they're going in the right direction for their overall health.
There you go. And Dr. Leia is going to take care of you, and she wants you to come in and get your vaccinations and your physicals when you go to school. So Dr. Leia, thank you so much.
Thank you.